what are these instruments for? Well, I am gonna tell you that I look like an astronaut right now with these glasses and this headlight, which is an illumination for me. It's a great illumination. But I want to introduce you to Panchito. This is the way I work without the microscope. And Panchito has been my companion during all my dental career, and he let me practice in his teeth, and we used to do that before we practice in patients live. Well, the first thing you're gonna see is what is this instrument that nobody has told you before. The handpiece is making a horrible noise. How many of us we are not scared about this noise? This is the noise that we hate. But I gave my patients AirPods. Sometimes I gave them an AirPod and they can watch also a movie at the same time. Some of them want to watch me and the microscope screen when we're doing it in their mouth. But you can see here that I'm working in two premolars, and we are designing a specific shape that we are requiring in endodontics. The first instrument that we use is a round bird, and we start using this bird to get inside the canal. This is a diamond bird, and we have to use, after placing the rubber down, this green rubber that you see is gonna protect us from bacteria outside the mouth. Then I use an endodontic explorer that you saw on the video. And in this case, you're gonna see now when I have to do with the round bird, and then I have to change to a fisher bird. With the fisher bird, we're gonna have to go in a different way, and we're gonna open the canal better. So every instrument has their own function. That's why it's very important that you go to an endodontist to have your root canal treatment, or a dentist that has dedicated his life to do root canals only. So in this case, you're gonna see the canals better when we drive the canals. We don't dry in this way in a patient. We use paper points, but in a case that I wanted to dry it so you can have a better view of what we see in endodontics, which is an endodontic access. That's one of the canals between many of the others. And this is just for educational purpose for you. And then this is the endodontic explorer that we have to use during the treatment to feel that we are already in the canals. In this case, every one of these teeth have 2 canals, and this is a molar that's gonna have 3 or 4 canals. So that's the way we are gonna feel it, whether we have the microscope or not. Technology is great, but we always need to remember our basic knowledge, like my mentor in endodontics in my program used to tell me. So now, when we have a handpiece, this is a sonic instrument. As you saw on the screen, there are different tips, and they have different use. We have surgical ones with during surgery, but in this case, for example, if we're using, you see an endodontist that is using this ultrasound machine with different tips, is because, like in this case, we were looking for a third canal, and this was in the access. We were suspicious. We knew it was. We went with Endodontic Explorer, and then we start filling the canal, and then we go back with an endodontic tip. The videos that I'm using is a courtesy of Dr. Marcos Japasalo, who has made plenty of videos for teaching purpose, and many of us would donate videos to him so he can have the students learning. I use it for my patients. But anyhow, this hand ultrasonic machine is going to help us to have a better visibility of the canals. So when you see sometimes an endodontist saying, oh, okay, I need this type of rotary instrument, then in this case, I'm using an old rotary files. There are blue rotary files. And in the beginning, I use LAX bird. This is a rotary bird designed by Dr. Steve Buchanan. And then after that, we use this other one, which is a Protemper file designed by Dr. Cliff Ruddle. So these machines is amazing because they go into the canal and they start literally drilling. This handpieces is a copy of Archimedes' instrument drill that was used in the ocean. So when you see different instruments that your endodontist is using is because we have a sequence of instruments that we use to clean the canal and give the shape that we need to be able to clean correctly all the bacteria from there. At the end of the treatment, I use another machine, which is an obturagon. I hardly use it anymore, but it's used only to fill out the little spaces that we need to fill out. Many people use it to fill the full canal. I just use it to fill out at the last minute, the last 2 or 3 millimeters from the canal. It really helps when you need to work faster in this type of treatments. But now with the use of the garapercha that is similar to the instrument that you use, everything matches and we can have a hermetic seal perfectly with the BC sealer that we use. But we're talking today about technology. The other one is a system B. It has to be in a maximum of 200. We have the maximum intensity, and what it does is that it gets so hot the tip that it allowed you to remove the garapercha from the canals. Like in this case, we are removing the garapercha from the canal, and after that, I clean the access so the referring dentist can have, a clean area. There is another machine, and this machine, it's a ZX Morita designed by Morita. And what they do, they develop this machine, which is amazing. It's like a not ultrasound, is like a submarine, sorry. And this is like a sonar machine where you place certain instruments in another ones as an endodontist, and you will hear the endodontist say, give me the Morita, and it help you to measure the canals. Then we have, this is like they said, oh my God, this is like the latest of the latest technology in endodontics, which is irrigation. However, I'm extremely disappointed about the machine because this machine, the white one, is disposable and it costs an arm and a leg. The machine is expensive and the handpiece, of course, is disposable and is expensive. I advised some modifications to the company that I never got a credit for, and it's a specific instruction how to use it. The patients look for it a lot. I put a barrier on the top of the white area that you see after the tooth is clean, and that top is going to help me seal the area so nothing comes out. It has a specific pedal as you saw in my foot. And look how the screen is going to show you how the first solution is being used, how it goes in the canal. And it's called gentle wave because the irrigation goes in waves. And in this way, it's extremely clean the canals. I tell my patients that after having a root canal with me and after the gentle wave, they're going to have the cleanest mouth in the world. And of course, we're always laughing, but a gentle wave is looked by so many patients, and I don't work for the company. They know I don't agree with some of the stuff they do, but it's a good technology. We're talking about technology.
Endodontics is the last specialty that helps us avoid extraction. Avoid endodontics by brushing your teeth and flossing at night. See you later.